Introduction. One of the most pressing social problems is teenage pregnancy. In particular, it concerns underdeveloped countries, areas with a low level of sexual education, widespread adolescent marriages, and a low level of universal development. Teenage pregnancy is of particular interest for research as it has an effect not only on the young mother but also on the child. It is crucial to examine potential issues such as the development of health problems in adolescent girls, problems with pregnancy in their children in the future, mental well-being, and societal stigmatization. Therefore, this work sets itself the task of investigating the biological and psychological consequences that teenage pregnancy has on young mothers and their children. This research paper will provide information about the basis on which the research methodology was chosen. Furthermore, a literary review of the most relevant evidence-based sources will be provided, on which the discussion and conclusions of the study will be based. In the discussion section, the research will examine the selected topic of the impact of teenage pregnancy on mothers and children and its effects on their well-being, and social and psychological implications. Therefore, the leading causes and biological, psychological, and social consequences of teenage pregnancy will be analyzed. In addition, ways to solve the problem will be described, such as concurrent interventions, including education, skill building, clinical and social support for teenage mothers, and contraception services. At the conclusion of the work, the primary outcomes of the conducted research will be provided. Methodology. The current work utilizes systematic review as the primary research methodology. This option is a practical framework for a broad scope of research and summarizing information about a chosen topic. Hence, the study will examine evidence-based sources to collect information about teen pregnancy and its potential effects on young mothers and their children. This approach will help identify the most pressing issues on the topic and provide an answer to the proposed thesis. Literary review. There is extensive literature on the topic of teen pregnancy specifically because it is a highly relevant problem in most developing countries and nations that lack clear sexual education. The existing research primarily focuses on the physical, psychological, and social consequences of adolescent pregnancy. The literary review by Paller et al. Examines the common themes regarding biological complications in the initial search of 2,260 articles. The findings demonstrate that teen pregnancy significantly increases the chances of difficulties during pregnancy and childbirth. Some of the problems include higher risks of preterm delivery, gestational diabetes, urinary tract infections, maternal anemia, and other complications. Another study by Akter highlights the elevated chances of teen mothers developing depression, post-traumatic syndrome, and other psychological problems compared to adult mothers. In summary, there is sufficient evidence that teen pregnancy has direct consequences on the physical and psychological well-being of adolescents. Discussion. Teen pregnancy problem. The primary problem of teen pregnancy is that the bodies of adolescent girls are still in the development stage, and they cannot handle the physical strain of pregnancy. There are three primary phases of adolescence: 10 to 13 years, early, 14 to 16 years, middle, and 17 to 19 years, late. Physical bodies and cognitive functions are heavily underdeveloped during the former two stages, and teen pregnancy can have particularly adverse effects on young mothers from 10 to 16 years old. Adolescents older than 17 years old generally are more developed physically and mentally. However, there are still relevant risks of pregnancy complications, particularly in the social aspect. Ultimately, teen pregnancy is a critical problem for all young mothers, but severe physical complications are significantly more likely for girls during the earlier stages of adolescence. Psychological effects. Teen pregnancy has pronounced psychological effects on adolescent girls. The research by Gselamu et al. Found that clinical depression, social isolation, stress, and elevated risks of substance abuse are some of the most prominent psychological consequences in teen mothers. As the authors note, it primarily occurs due to insufficient development of cognitive function in adolescents, and young mothers are not mentally prepared to provide care. Moreover, since there is a higher chance that children of teen mothers develop physical complications, there is a relevant problem of financial burden. As a result, most young mothers cannot overcome the multiple issues associated with teen pregnancy, resulting in stress, depression, and potentially post-traumatic syndrome. Effects on the health of mothers and children. Physical or biological consequences remain the primary problem for young mothers and their children. There is extensive research that demonstrates a positive correlation between adolescent pregnancy and such complications as preterm birth, gestational diabetes, perineal tears, low birth weight, and other fetal risks. Another study by Kyozuka et al. Found that placental abruption, which might have lethal outcomes for the baby, is significantly more prevalent in teen pregnancies compared to adults. Additional risks, such as smoking and pre-existing conditions, are relevant factors that contribute to physical complications. However, early pregnancy was the most statistically significant variable that had adverse effects on the health of mothers and their children in the study. In other words, teen pregnancy is a relevant problem even compared to other common aggravating factors, such as substance use and chronic conditions. Social effects. Lastly, it is essential to discuss the social effects and consequences of teen pregnancy. In this context, the stigmatization of adolescent mothers is a relevant problem since society generally rejects them and refuses to provide sufficient care. The research shows that social isolation is one of the most common consequences, as teen mothers frequently lose connections with friends and even relatives due to early pregnancy. This separation from close people might result in depression and stress for adolescent girls. In addition, the research shows that fathers frequently leave their children, especially if the pregnancy has not been planned. Ultimately, these problems emerge from multiple causes, primarily including social stigmatization and uncompleted cognitive development of teen mothers who might not be prepared for pregnancy. Conclusion. Teen pregnancy remains a critical problem in multiple countries globally, and it is particularly acute in developing nations. It leads to various physical, psychological, and social complications, making teen mothers feel alone and abandoned. Even if the pregnancy does not cause additional medical problems, the issues of social isolation, financial burden, and associated stress might result in difficult parenthood. Ultimately, it is crucial to raise the level of sexual education and mitigate associated factors with teen pregnancy to mitigate physical and psychological consequences for young mothers and their children. You can find this and many other essay samples on our website studycorgi.com.